Welcome back in this morning's Health Check. Harris County has issued a health alert after a 1-year-old boy was diagnosed with measles. The patient apparently visited several healthcare providers after contracting the virus, and the virus may have been passed on to other people. The contagious rash and illness, the subsequent illness that results, prevented, of course, with the vaccination. Here with more on the symptoms and the treatment for measles is Dr. Melanie Mozoon. She's from the Kelsey-Seybold Clinic. Dr. Mozoon, good morning.
Good morning.
People hear measles and certainly become concerned because this is a potentially fatal virus, and certainly in a child that small, a 1-year-old, would be of great concern to parents. Tell us a little bit about this particular health alert and what we know about this patient and his travels prior to the diagnosis being made.
So this child traveled internationally and acquired measles overseas and brought it back to the United States while he was incubating it and became ill here in the United States, where he visited a physician's office and I believe a hospital as well. Measles causes high fever as well as a red rash, but the red rash doesn't show up for several days. So it's preceded by the high fever, cough, runny nose, watery eyes, and feeling really quite ill. And it's really difficult to diagnose in that stage until the rash begins. The rash starts around the hairline and spreads sort of down the body and out the extremities. It starts as small red bumps, and then they become much, much larger and sort of till your whole body is covered with this red rash.
Now, parents would know that many children do have rashes from all kinds of other sources, many of those benign. How do you know the difference between something that could just be an irritation that would happen on a child or something more serious like this?
Well, in a child this child's age, around a year, it's very common to have viral rashes where the child doesn't really feel very ill, but you feel pretty ill with measles, even early on before the rash shows up. So I think most physicians would see this child for the high fever before the rash developed. And the tip-off is that inside their mouth they may have little white spots called Koplik spots, which only occur with measles. So there are little hints about whether this is measles or not, but you have to be very careful to look for them.
Yeah, that early stage issue is really of great concern here because this child could have been exposed to many other people, exposing them potentially to this virus. So far, we don't know of any secondary cases, right?
Right. And so that's really a great benefit of the immunization status that we have here in Houston. Houston has a really well immunized population, and so secondary spread really has probably been interrupted by our high vaccination status.
So even though measles is highly contagious, most of us had that MMR vaccine, is that right?
Right. And so if this child only came in contact with immunized people, then secondary cases will not occur, and that's really what happens when the population is immunized. Nothing happens.
Do we know anything about why this child may not have received MMR?
He was too young.
Okay.
Well, actually, I should change that. He was too young for the standard dose of MMR, which is at a year. Actually, it's very important that children traveling overseas from the age of 6 months to a year can be immunized with the MMR. It won't count as one of their 2 doses that they're required for school entry because it's not as effective in a 6-month-old as it is in a 1-year-old, so it's not as clear that it'll produce lifelong immunity, so they still need the 2 doses later. But any parent who's traveling with an infant less than a year overseas should consider getting this vaccine.
Well, that's good information, and important to note that young children, very, very small babies who would not have been immunized would be at the most risk to be exposed if they came in contact with someone like this.
Right, and in Houston we have a lot of people who are vulnerable to measles because we have lots of people who are here getting bone marrow transplants, who are on chemotherapy, so it's not really just the young infants, but certainly all children under the age of 1 who haven't had their MMR are vulnerable.
All right, and of course those who are immunocompromised. Thank you for mentioning that, Dr. Mozoon. For the latest health-related headlines, head to abc13.com. Just click the Health Check tab on the left side of your screen.